Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about hypertension. This is based on the viewer's recommendation. I am uploading this video. Hypertension is a systemic hypertension is defined as a systolic pressure equal to or above 140 mmHg and the diastolic pressure is equal to or above 90 mmHg. The measured as a two or more different occasion. We should measure in the two or more different occasion. This is hypertension. We should not conclude with the taking a blood pressure one time. We should do two or more times for confirming before it is an hypertension. When the systolic pressure, normally the systolic and diastolic pressure is 120 by 80 mmHg. Systolic by diastolic is 120 by 80 mmHg. In hypertension, it increases to the 140 by 90 mmHg. So, when the systolic means contraction of the ventricles and the diastolic means the ventricles gets filled up with blood. This is known as diastolic period. The systolic period, when it is 140 mmHg, it is said to be hypertension, and the diastolic pressure is 90 mmHg, it is said to be hypertension. The etiology, what are the causes of this hypertension? The renal disorders like renovascular stenosis, polycystic kidney disease, parenchymal renal disease. When the vascular of the kidney gets stenosed, it gets shrunken. This causes hypertension, and the polycystic kidney disease and the parenchymal renal disease. It can be due to endocrine disorders as well as in the drugs and the miscellaneous. These are the etiologies of the hypertension. And the endocrine disorders are phenochromocystoma, Cushing syndrome, acromegaly, hypothyroidism or hyperthyroidism. In these endocrine disorders, we can see the hypertension. In the drugs are oral contraceptive drugs like corticosteroids and NSAIDs and cyclosporine. These are the drugs which increases the hypertension. And the miscellaneous are toxemia of the pregnancy, contraction of aorta, and obstruction sleep in apnea. And these are the etiologies which causes hypertension. The renal disorders, endocrine disorder, drugs and miscellaneous. These are the causes which causes hypertension. Now we will see about the clinical features of this hypertension. The majority of the patient are asymptomatic and diagnosed in the routine examination. On routine examination, many of the patients are asymptomatic. The common symptoms are occipital headache behind the head, which is the parietal bone, and behind it is occipital neck. Just behind, in front, in the upper side of the neck. From the neck, the neck upper side, which is known as occipital area. In that, the headache is felt, and dizziness and palpitation and fatigueness. These are the common symptoms which is seen. Some patient may also present with the symptoms which are targeted in organ damage. It can be the hypertension also can be in the organ damage, which are epistaxis. Nasal bleeding is seen due to the injury of the sphenopalatine artery. Hematuria, urine in the blood is seen. Blood comes in the urine while urinating. Blood vision, angina and breathlessness. The various symptoms pertaining the underlying causes are due to the causes which we have seen. It can be also from the causes there can be also symptoms. They are weight gain can be seen in the Cushing syndrome, weight loss in the thyrotoxicosis, episodic headache and palpitation and sweating can also be seen due to that symptoms. History should be taken. The name, age, sex, occupation, lifestyle, smoking, diabetes mellitus, hyperlipidemia when the lipid content is more, diabetes mellitus when the high blood sugar level is more, alcohol, drug and intake. These history should be thoroughly examined in the clinical feature. Physical examination. In Cushing syndrome, we can see the obesity in the patients. In polycystic kidney, we can see palpable kidneys. When we palpate the kidneys, we can feel the kidneys. Chronic nephritis, recurrent urinary infection. is seen. Signs. What are the signs of the hypertension? The heaving of apex, fourth heart sound is heard, loud aortic second heart sound is heard, pulmonary crackles are heard. These are the complications, signs of the hypertension. Complications. Complications are the CNS, ophthalmic, cardiovascular complication, renal. These are the complications which are being in the hypertension. The CNS are cerebral ischemic attack, stroke, subarachnoid hemorrhage. These are the complications in the CNS. And the ophthalmic are hypertensive retinopathy, where the thickening of the retinal arterioles are seen. Cardiovascular complications are coronary artery disease, left ventricular failure, aortic aneurysm. And the renal are proteinuria as well as the renal failure. The diagnosis of this hypertension are, it can be divided into basic investigation as well as the final investigation, special investigation. The basic investigation are urine examination for protein, whether the proteinuria is present in the blood glucose level, glucose urine is present, to see that whether the patient suffering from diabetes. Serum creatinine and blood urea nitrogen for the renal function test. Serum electrolytes are seen as well as the plasma urine. Complete serum lipid profile is seen. Chest X-ray for cardiomegaly. When the heart is enlarged, the X-ray can be seen, and the heart failure condition also chest X-ray. These are the basic investigations which are seen. The special investigations are X-ray of the chest and echocardiography, renal arteriography, plasma renin activity, and MRI of the contraction of the aorta. These are the special investigation ones are X-ray of the chest and echocardiography, renal arteriography, plasma renin activity, angiography, and MRI for the contraction of the aorta. The management of the hypertension are, it can be divided into non-pharmacological as well as the pharmacological. The non-pharmacological are salt restriction should be given, 2.4 gram sodium and 6 gram NaCl is effective in controlling the hypertension. Weight reduction should be given, stop smoking due to the increase in BP, limit the alcohol intake, regular exercise, and the various relaxation like yoga and physiotherapy should be given. These are the management for the hypertension. The first one are non-pharmacological, which is salt restriction diet and the weight reduction, stop smoking due to the BP in the increases, limit alcohol intake, regular exercise, and various relaxation like yoga. The pharmacological therapy are diuretics should be given, beta blockers, calcium channel blockers, ACE inhibitor, vasodilator. These should be given. The beta blockers are propranolol 40 to 160 mg per day. Calcium channel blockers are nifedipine and febidipine 16 to 20 mg. The ACE inhibitor are enalapril, amlodipine 5 to 10 mg is effective. The vasodilator are digoxide, the sodium nitroprusside. These are given. These are the vasodilator which are given in the pharmaceutical therapy. That's all about the hypertensive. Thank you. If you like this video, please do like, share, and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. If you want any other videos, please do suggest in the comment box. For notes, please do follow my Instagram page. I will provide the link in the description box. Thank you. Please do subscribe.